Okay, so today we are going to discuss the head and neck topic, anatomy, meninges. So, what are the layers of meninges? The brain, as well as the spinal cord, is surrounded by three layers of membranes. A tough layer, outer layer, the dura mater, a delicate middle layer, which is called the arachnoid mater, and then inner layer, firmly attached to the surface of the brain, the pia mater. Okay, so you should also remember this. The dura mater has two layers actually. One is the endosteal layer, which is stick to the outer skull, the bony skull, and the other layer is the meningeal layer, which is more towards the meninges, like more like meninge. Okay, so further, the cranial meninges are continuous with the cranial meninges are continuous with and similar to spinal cord meninges through the foramen magnum, with one important distinction: the cranial dura mater consists of two layers, and only one of these is continuous through the foramen magnum. As I said earlier, dura is composed of two layers. So this dura, the cranial dura, has two layers, and the when it goes out of the foramen magnum with the spinal cord, it is one layer only. Okay, so here we have a beautiful diagram. This is the sinus, sagittal sinus, and this is the skull, the outer table, the inner table, and this is the inner meningeal layer of dura mater, this one, and the outer, which is stick to the bone, is the outer periosteal layer. This is the outer periosteal layer, and this is the inner meningeal layer. Okay, so further we go. Okay, as we said that outside the cranium, it has only one layer. Okay, only one layer, spinal dura mater. Okay, so what are the layers of cranial dura mater? So the outer periosteal layer is firmly attached to the skull, is the periosteum of the cranial cavity, contains the meningeal arteries, and is continuous with the periosteum of the outer surface of the skull at the foramen magnum and other intracranial foramina. So the outer layer is strictly attached to the periosteum, and it continues with the periosteum through the foramina and the foramen magnum, and the inner meningeal layer is in close contact with the arachnoid mater and is continuous with the spinal dura mater through the foramen magnum. The outer layer contains meningeal vessels, meningeal arteries, and vessels. What are the dural partitions? Do you know? The dural partitions project into the cranial cavity and partially subdivide the cranial cavity. They include the falx cerebri. Okay, so these are the modification and projection of the dura mater. So this is falx cerebri, tentorium cerebelli, falx cerebelli, and diaphragm sella. We will discuss these further. What's the structure related to the sella turcica? So diaphragm sella. So here, this is your sella turcica. This is your pituitary. Okay, so above this we have this diaphragm sella, which is the modification of the dura mater actually. So this is diaphragm sella. So what's the structure related to a sella turcica? So diaphragm sella, which is a double layer fold of dura mater. Attachment of falx cerebri. These are very important. These are very important. Apex attached to the frontal crest and cresta galli. This is your skull. Here is the anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. So here we have in the center the cresta galli. So it is falx cerebri is attached to the cresta galli apex with base with the upper surface of the tentorium cerebri. Here we have a shape like this, the tentorium cerebri. So it rests on it like this here. So base is here, and upper border to superior sagittal sinus, and this is like this, a 3D structure, a 3D structure. So here we have the superior sagittal sinus. I will show you here. Wait. So here you can say this, here the attachment to the sagittal sinus all along. This is a 3D view. So upper border is supposed to sagittal sinus free border, lower free border free above corpus callosum. It is free above corpus callosum. We will see the diagram, you will understand. So front is crista galli, base is tentorium cerebelli, and the upper portion or upper body is attached to the superior sagittal sinus. Attachment of falx cerebelli. So base is attached to the inferior surface of the tentorium cerebelli. So base, it's also base is attached to a tentorium cerebelli, but from lower side, and from the above side is the falx cerebri. From lower side will be the falx cerebelli. At posterior part of the foramen magnum, okay, and anterior free border are related to vermis of cerebellum, okay. Posterior attached border attached to the occipital crest, okay. So here you can say this is falx cerebelli. So falx cerebelli posterior, here it's attached to occipital crest, okay. The base rests on the tentorium cerebelli. This is your tentorium cerebelli all around. This is your falx cerebri, and here we have the falx cerebelli. So it also continues downwards. So base will be attached on tentorium cerebelli, posterior occipital crest, and in front it is attached to the free margin, posterior free margin of the foramen magnum, and anterior free border related to vermis of the cerebellum. So here on both sides there will be this cerebellum. Cerebellum has two halves like cerebrum. So on each side it will be the cerebellum, and in between the cerebellum there is a vermis. Area is called vermis. So the anterior free border will be related to the vermis. Anterior to the vermis. Here one lobe, other lobe, here will be the vermis. So anterior border will be related to vermis. Attachment of tentorium cerebelli. So anterior border attached to the superior borders of the petrous part of the temporal bone. Superior border of the petrous part of the temporal bone known as the posterior clinoid process. Okay, through the anterior and posterior petroglenoid folds, anterior most border is free. Okay, I will show you in the diagram. Posterior border along the transverse sinuses grooves on the occipital bone. So I showed you earlier that I will remove it. I showed you earlier that here we have, this is the tentorium cerebelli. Tentorium cerebelli. So here anterior border of it on both sides, it will be attached to the petrous part of the temporal bone, superior part of the petrous part of the temporal bone, and its base will be attached to, here will grow it, this, let's suppose occipital bone, it will grow it along with the sigmoid or transverse sinus. Okay, so these are the attachments of the the tentorium cerebelli. So posterior border along the transverse sinuses grooves on the occipital bone posteriorly. Upper and lower edges are connected to superior sagittal sinus and inferior sagittal sinus. Superior sagittal sinus and inferior sagittal sinus. So these are the arteries supply the dura mater. Anterior meningeal arteries in the anterior cranial fossa, middle and accessory meningeal arteries in the middle cranial fossa, and posterior meningeal artery and other meningeal branches in the posterior cranial fossa. What's the blood supply of the tentorium cerebelli? Posterior meningeal artery, a branch of the ascending pharyngeal artery; occipital artery, a branch of external carotid artery, and tentorial branches of the posterior cerebral arteries. So this was all about the dura and modification of the dura. Thank you.